Thank you, David. And I want to thank you all for coming today. I'm so happy to be here celebrating Lupus Awareness Day. Woohoo! But I'm also glad that we're here together as a community and bringing together those not only with lupus, but all autoimmune conditions. Tomorrow is also Mother's Day and the kickoff of National Women's Health Week. I also want to invite everyone to stay and join us after this presentation for a gathering of hope to recognize all of those in our community who have lost their fight with lupus. As some of you know, I co-founded Molly's Fund nearly 8 years ago, and I can't believe how far we've come during that time. You're welcome. Not only as an organization, but how we've helped bring awareness to lupus and supporting those living with this disease. We have an amazing year at Molly's Fund that was filled with growth and hope. We've rebuilt our website to make it more accessible and appealing to our growing audience. We've also helped numerous people with our patient assistance program that provides help to those with lupus with housing, gas cards, bill payment, and various other needs. Molly's Fund holds in-person support group meetings as well as 2 online support group meetings. Each day we are receiving more requests to start groups all around the country. We are eager to provide as much assistance as possible to those who reach out to us so that we can continue to grow our support group network. We have an amazing social media presence that allows us to reach hundreds of thousands of people. Whether it be Facebook, Pinterest, Twitter, or Vine, we will be there sharing information for our patients and their loved ones. We have started an exciting partnership with the Alliance for Lupus Research. This will allow both organizations to provide assistance to the patients, whether it be through encouraging clinical trial participation or finding a doctor near you. We hope that this partnership will be lasting and productive. Next year, we'll also be partnering with OMSI here for a wonderful opportunity to reach out to the general public and inform them about lupus. We'll be unveiling several new exhibits about lupus and how the body works, featuring MAC the molecule. There will also be a curriculum built for the 6th grade students throughout Oregon and Southwest Washington that will teach them about lupus and how it affects the human body. This is also the 1-year anniversary of our newest program, 1 in 4 Chronic Health, the Chronic Healthcare Advocacy and Policy Coalition in Oregon and Southwest Washington. Let's thank them. At this time, I am pleased to introduce Dr. Thomas, who has come here all the way from the Washington, D.C. area. We are excited to be building a relationship with him as he is dedicated to working with and advocating for lupus patients. He is a board-certified rheumatologist and physician, and he is in private practice with the Arthritis and Pain Associates in Greenbelt and Clinton, Maryland. He has been an active member of the Medical Scientific Advisory Council for the D.C., Maryland, Virginia chapter of the Lupus Foundation of America since 1999 and currently serves as its chair. In addition to his love of taking care of patients, he also loves teaching other physicians about rheumatology issues as an assistant professor of medicine at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. He is a strong advocate for people who have lupus and is the author of the upcoming book from Johns Hopkins University Press entitled The Lupus Encyclopedia, a comprehensive guide for patients and families. I want to remind everybody that if you have any questions, to please write them down on the slips in front of you, and we will complete those questions at the end of the presentation. At this time, please join me in welcoming Dr. Thomas.
Today is Lupus World Day. The butterfly is our emblem for lupus. Why is it our emblem? I'll come to that at the end of our talk. A few months ago, I was writing an article in conjunction with Molly's Fund with Carrie, an article about lupus, and she asked me, she said, can you come to Portland, Oregon for Lupus World Day and possibly give a talk to us about lupus? And I thought, well, I love to educate people about lupus, and I love to travel, and I've never been to Oregon, so yes, I'd love to come. So the first thing I did is I get on my computer, and like anybody on the internet, I Google Portland, Oregon. Portland, Oregon. Oh my goodness. I was thinking, you know, I'm pretty open-minded, but how am I going to talk to these people? And, you know, what if they had something stuck in their teeth? What am I going to tell them? What's the right etiquette? So I thought about it a little bit longer. I did some more Google searching about Portland, and I found this documentary about Portland. So I go, okay, I'll order this from Netflix, learn a little bit more about Portland. And they're pretty quirky, they're pretty funny, and I thought, okay, I can get along with these people pretty good. And so yesterday I get on the airplane at Dulles Airport, take the 5.5-hour flight here to Portland, landed here late last night. And I get here and I start to meet the people at Molly's World, the people of Portland, Oregon. This morning at Starbucks, the person behind the counter, she was so nice and she said, "Howdy doody." I thought, I just feel like I'm just at home. The people in Portland, Oregon are down to earth, nice. They remind me of my friends and family at home. You've just been so welcoming and so inviting, so I'm really glad to be here today. So the Lupus Secrets, these are not really secrets at all. Why do I call them the Lupus Secrets? I call them the Lupus Secrets because most people with lupus do not know these, but they're very important for people with lupus to know. And so since they're not well known, I call them the secrets. As most people with lupus know, lupus is an incredibly complex disease. People with lupus are born with the genes that they get from their mother and the genes that they get from their father, but it takes something in the environment to trigger the disease to turn on. And these triggers can actually make lupus worse as well. Lupus can attack every single part of the body, and lupus can cause many complications that most people don't even realize can possibly occur to them. So this disease, which can cause such horrible things to the body, is just a bad thing to put up with, but there's a lot of things that people with lupus can do in order to take care of themselves and do better with this disease. The triggers can be avoided, the complications can be lessened, and I think that people, if they learn these secrets, they can learn how to take control over lupus rather than letting lupus control them. So my goal during the next 45 minutes to an hour is to basically share some of those facts with you guys so you can take them home with you and learn how to control lupus yourself. So secret number one is avoid sulfa antibiotics. And by the way, all these are in your handout, in your folder, and they're in a lot more detail in the handout. But first of all, please avoid sulfa antibiotics. Septra and Bactrim especially. We don't know why, but Septra and Bactrim, the sulfa antibiotics, can cause lupus to flare. And don't just try to remember this, actually put it in an allergy list. I recommend that all people with lupus carry around a little card that has their allergies on it, your medications, and your medical problems, and so that you can always have that available if you're in an emergency situation. Every single year I get one or two of my patients who comes in with a severe lupus flare because they forgot to tell the doctor that they can't take sulfa antibiotics. They went to the emergency room with shaking chills and high fevers. They're so sick they can't remember everything, and they forgot to have their allergy list with sulfa antibiotics on it. They got the Bactrim or Septra, then they had a severe lupus flare. So please add these to your allergy list. Secret number two is please keep a home medical records. Don't leave it up to the doctors to communicate with each other. We're not very good at that, or at least some doctors are not. And it's really important that you get copies of all your labs, that you get copies of all of your doctor's notes, or as many of them as you can get. If you've ever had a kidney biopsy or a skin biopsy, keep it as well. I've had a few patients who had to move somewhere else and saw a new rheumatologist, and when they got to their new rheumatologist, they were doing so well, and there was nothing in the blood work, and their anti-nuclear antibody was negative, which happens in 20% of lupus patients when they're doing well, and they were told they probably didn't have lupus and their medicines were stopped. And unfortunately, all three of those patients ended up having a flare. One was a poor young woman who ended up having a severe stroke and had great difficulty talking. And so if you keep your own medical records at home and can show those to your new doctor, then that can prevent this type of problem from ever happening in the first place, because nobody contacted me to get my records so I could prove that that person had lupus. Secret number three, unfortunately, heart attacks and strokes are the #1 killer in lupus, and it's really important to learn how to protect yourself and prevent heart attacks and strokes. The studies show that especially African American women with systemic lupus get heart attacks and strokes 20 years younger than their peers. In African American women, we see those heart attacks and strokes about 70 in their 70s, but in our lupus patients, on average, they're in their 50s. I have patients in their 20s and 30s who have had heart attacks and strokes. So it's really important to learn how to prevent those heart attacks and strokes. We've had numerous studies over the past 15 years to prove that lupus causes heart attacks and strokes. And finally, the American Heart Association in 2011 came up with this update where they actually said women with systemic lupus and other systemic autoimmune diseases without clinically relevant heart disease should be considered at risk for heart disease and screened for heart disease, just right up there with cholesterol, high blood pressure, diabetes, cigarette smoking. Lupus is in that risk category group now, according to the American Heart Association. Not only that, but they also said that young women who have a heart attack or stroke, that they should actually be screened for diseases like systemic lupus, because it's that much of a risk factor for heart disease and strokes. So secret number 3 is do everything you can to prevent those heart attacks and strokes. If you do have any other risk factor whatsoever, such as high blood pressure, cigarette smoking, a family history, diabetes, please take 81 milligrams of aspirin a day to help prevent heart attacks and strokes. In addition, if you're positive for antiphospholipid antibodies, which 30 to 50% of lupus patients are, it's another important reason to take aspirin every day, because these antiphospholipid antibodies will cause blood clots and cause these heart attacks and strokes as well. If you don't know if you're positive for these, ask your rheumatologist, because we do check for these antibodies in every single one of our lupus patients. Do you feel down in the dumps? Do you have pain all over your body? Do you feel very fatigued? Most patients with lupus do feel a lot of fatigue. Difficulty sleeping at night? Trouble with concentration and memory? If you have these types of problems, please consider the possibilities of fibromyalgia, depression, and anxiety disorder. These problems are very common in lupus. In fact, 30 to 50% of patients will have a chemical imbalance disorder called fibromyalgia, which is horrible. It causes severe pain, it causes severe fatigue, and we can give these patients all of the methotrexate and Plaquenil and prednisone in the world for their lupus, and it's going to do absolutely nothing for these disorders. And many patients with these problems don't know they have them. In fact, a recent study on depression in lupus showed that a large percentage of lupus patients have depression, and it's not being addressed, diagnosed, nor treated. So in your handout, I actually gave some tests that you can take home and do yourself to see whether you may have fibromyalgia, depression, or anxiety disorder. If you score highly on any of those tests, please show them to your doctor and ask them if you might have fibromyalgia, depression, or anxiety, because the treatment is completely different than what it is for the autoimmune disorder of lupus. I look at tongues all day long, and there's a very good reason for that. Dryness is a very common problem in our lupus patients due to a condition called Sjogren's syndrome. And on the tongue, you can see this tongue has a lot of furrows on it, and it's not nearly as moist as a normal tongue should be. And this person is a lupus patient who does have Sjogren's syndrome. Sjogren's syndrome is a problem where the immune system attacks the glands of the body, and it causes dryness in the mouth, dryness in the eyes, dryness of the skin, itchy, dry skin in the wintertime especially. And the problem is that most people don't realize that this dryness is actually related to their lupus. And it's a really important thing to diagnose and treat, because, for example, the dryness of the mouth can cause significant medical problems. If you don't have enough saliva in your mouth, you can actually get infections in the mouth, gingivitis, thrush, and you lose teeth at an earlier age. And the earlier you can get diagnosed and treated, the better you're going to be. So if you have any dryness at all, point it out to your rheumatologist and ask if this might be the cause, because we do have good treatments. Especially if you're positive for SSA or SSB antibodies. The SS stands for Sjogren's syndrome, but you don't have to have those antibodies to actually have Sjogren's syndrome. And also Sjogren's.org, the Sjogren's Foundation, is a great source of information about Sjogren's. Next, keep your secret number 6, keep your blood pressure below 140/90. It's really important to, a lot of times, to take your own medical care in your own hands. And if you go to the doctor once or twice and that those numbers are higher than 140 over 90, I'd recommend you see your primary care physician regularly, like every few weeks even, until you get it below that number, because as long as it stays above 140 over 90, you're at high risk of those heart attacks and strokes. If you've ever had a stroke, if you've ever had a heart attack, or if you have protein in your urine from lupus nephritis, then the numbers are should be even lower. They should be less than 130 over 90. Cholesterol. It's very important to follow your cholesterol, of course. This cartoon shows two important types of cholesterol. On the left side is LDL, low-density lipids, and then the right is the HDL, or the high-density lipids, lipoprotein lipids. And the LDL is the bad lipids. This is the one that actually clogs up the arteries and that can lead to the heart attacks and strokes. And then this is the good HDL, the cleaning up all that bad cholesterol. And classically, we say that if you have a lot of HDL or high-density lipoprotein, that you're not at risk for heart disease. Has anybody ever in here been told that they have a good high HDL level and that you're not at high risk for heart disease? Well, guess what? Lupus does not follow the rules. Unfortunately, Dr. Bevra Hahn, who's a lupus expert in California, in 2006, she was actually able to show that 45% of her lupus patients have a bad type of HDL called pro-inflammatory HDL. HDL is actually anti-inflammatory. Usually, in most people like us, 95% of us, our HDL is anti-inflammatory. But in patients with systemic lupus, they oftentimes will have a bad type of HDL that actually causes inflammation within the body. And these particular patients, those 45% of lupus patients who had this, they actually had more heart attacks and strokes compared to the lupus patients who did not have this pro-inflammatory HDL. The problem is that when we check the HDL in your blood test on your cholesterol profile, it's all added up together. The HDL number is the pro-inflammatory and the anti-inflammatory. We have absolutely no way to discriminate against them. So when you have a high HDL level with lupus, you don't know if that's protective or not. And unfortunately, 45% of the time, it's not going to be protective. So what can you do about it? Unfortunately, it's such a hard test to do. We don't have it available clinically yet. Hopefully in the future we'll be able to tell the difference between pro-inflammatory and anti-inflammatory HDL, but not right now. The one study shows how you can help yourself, though. In 2010, Dr. Bevra Hahn, the same doctor, she took her patients who had this pro-inflammatory HDL and also ones who did not have it, and looked at the differences between the two groups. And she found out that the systemic lupus, she found out that the systemic lupus patients who exercise regularly, that those are the patients who actually had the lowest amounts of pro-inflammatory HDL, and they had significantly less hardening of the arteries compared to the patients that did not exercise. So that's the biggest takeaway point, is if you do have a high HDL level, it's not necessarily helping you out, and you really need to exercise regularly to try to decrease it if you do have it. So high HDL is our seventh secret. It does not necessarily mean good cholesterol with systemic lupus. Secret number 8, please don't smoke cigarettes. Cigarettes is a death sentence when it comes to systemic lupus. Most of us know the bad things that it can cause to people who don't have lupus. But you know that cigarette smoking actually counteracts the effects of Plaquenil. Plaquenil is the safest medicine we have to treat lupus, but smoking cigarettes, we don't know why, but it actually decreases the effectiveness of Plaquenil. Number 2, smoking tobacco actually contains a chemical called hydrazine. Hydrazine is a trigger for lupus. It actually makes the immune system more active, and so when people smoke cigarettes, it's much more harder to control their lupus compared to people who don't smoke cigarettes. You're putting yourself at risk of requiring chemotherapy and high doses of prednisone and such. And of course, we know that cigarette smoking causes heart attacks and strokes. Also, lung cancer. Lupus patients actually have a higher incidence of lung cancer compared to non-lupus patients, and cigarette smoking is the key factor for them. And then, of course, our patients can get broken bones from osteoporosis, and cigarette smoking is a big contributor to that. So please work on stopping smoking. And I know it's not a simple case. Nicotine is incredibly addictive. I have family members who I feel so bad for because they just can't get off the cigarettes. But there are some ways to get some help, and I put some information in the handout on some places you can contact for some help with smoking. Secret number 9, exercise. And I specifically had this slide up here about dancing. Does anybody in here have problems with memory? Yeah, lupus patients have a high incidence of cognitive dysfunction or memory problems. Memory experts actually say dancing is the best exercise you can do for memory. And the reason for that is that you're using different parts of the brain, or what they call cross-training the brain. When you're dancing, you're not only exercising to stimulate your cardiovascular system, but you're also you're memorizing steps. You're also balancing, which uses other parts of the brain. You're listening to music, which uses another part of the brain. And all of this together actually helps with memory as well. But any type of exercise is really important for multiple reasons with systemic lupus. It decreases those bad heart attacks and strokes, of course. It decreases that pro-inflammatory HDL that I mentioned. Improves sleep. Sleep is a big problem in many lupus patients. Improves memory. And then lastly, fibromyalgia and depression, exercise is the most important part of our treatment program. Just the medicines themselves don't help very much. In fact, there was a study that showed that exercise for depression was just as effective as taking Prozac every day. So exercise is incredibly important for all these conditions. So a lot of my patients say, well, doctor, I don't have any time to exercise. I'm too busy. So I have this cartoon up in every single one of my examination rooms. And so the doctor comes back and says, so what fits into your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? And it's true. I mean, we really need to learn how to prioritize the important things in our life. And so many times we put the unimportant things first in our lives.